I'm speaking today with Mr. Amuda Baba, who has recently published an article with Rural and Remote Health titled Being a Midwife is Being Prepared to Help Women in Very Difficult Conditions. Midwives' Experiences of Working in the Rural and Fragile Setting of Ituri Province, Democratic Republic of the Congo. Welcome.
Thank you very much.
So I thought we'd first start by introducing the research team.
Yeah, thanks very much, Melissa. So this research was conducted by a group of researchers. We have Professor Sally Theobald. She's a professor in social science and international health at the Liverpool School of Tropical Medicine. We have Mr. Tim Martineau. He's a senior lecturer in human resources for health at the Liverpool School of Tropical Medicine. We have Dr. Paluku Sabuni. He's the director of the leprosy mission, but also a professor in public health and gender in Rwenzori Official University, which is in Butembo, northeastern DR Congo. We have Muzia Kukwa Nobabo Marie. She's a trained midwife, and she's working as the coordinator of Safe Motherhood Department at the Pan-African Institute of Community Health. This is the organization I work with. And we have Mr. Ajaruva Alitimango Pascal, who is a trained male midwife. He worked for many years at IPASC as in the Safe Motherhood Department. So we have Joanna Raven. She's a senior lecturer in health systems at the Liverpool School of Tropical Medicine. And finally, myself. So I'm the director of Pan-African Institute of Community Health in northeastern DR Congo, but also a PhD student at the Liverpool School of Tropical Medicine.
Fantastic. And so what are the challenges for midwives working in rural provinces in the Congo?
Yeah, actually, we have two sets of challenges, if I could put it that way. We have what I could consider health systems related challenges, but also we have some social cultural challenges. So in terms of health system challenges, one of the elements, there are very few qualified midwives in rural DR Congo. So these shortages of qualified midwives, this is one of the major challenges. But also one of them is the poor working conditions, as in most cases you find those midwives running short of equipment and some supplies. So there is a serious issues on that level. And sometimes they have problems in referring some problems who are having labor complications, labor problems, which need to be transferred or referred to a referral hospital, but they have the challenges as there are no means of transport to facilitate that challenge. And we also have the challenge in supplying them with equipment, as I said before, but also with some medicine and other element. And you have one of they don't have their salary. They only benefit from what they call risk allowances. So they don't benefit for salary as such from the government. And this really affects their work condition. So all these challenges are in a way exacerbated by the insecurity in the rural area. So where you have probably very few female midwives accept to go there because they run quite a number of risks of working in such settings due to insecurity. So in terms of social cultural challenges, you have like male midwives are rarely accepted to work in rural settings. Otherwise, women are not happy to use the health facilities to come and deliver in those settings. But also in case of maternal death happening in rural health facilities, you find that the community holds responsible the midwives working the facility. So the midwives are held responsible of any maternal death. So in case of there is maternal death, they'll be pointing by the population just to saying, if we lost our mom, if we lost our sister, it's because of that lady. So these are kind of, I would say, the challenges, which are both the health system related challenges, but also some social cultural related challenges as such.
Well, it sounds really complicated. So how can midwives be supported to work in the Congo?
Yeah, I think to support midwife, the good thing is it's better to understand their pathways, understanding why they join midwifery, and understanding what are the challenges they really face. And in front of those challenges, they don't just stop, but they develop some coping strategies to deal with these challenges, because they are really committed to supporting women in working in those settings. So when we understand their pathways, or in terms of why they joined, what are the problems they're facing, what kind of support they need, I think it would be much better to support them in different ways. Supporting midwives in such settings, as they said before, there is a problem related to equipment, and there is a problem related to professional support. So they want to work in a very acceptable environment where there is no insecurity. So supporting them is to make sure that there is security in rural areas, but supporting them is also to make sure that they benefit from enough professional support in terms of supervision and also training. So they could be actually the priority of receiving training, because what is seen in the field, it's only most of the cases, those who are in the center, those who are in the cities, in a big town, they are the one who benefit most from training. But we have the need in those settings. Actually, they could make sure that they focus the priority, or they prioritize midwives working in those settings. Because you have a huge number of people, huge number of population living in those settings, but also you have kind of the fertility rate is very high in rural settings, so they need support from midwives. So if midwives are not supported themselves, then it's the population health which is in a way affected, and that will affect the achievement of universal health coverage, especially in those settings, rural and fragile settings such as Ituri.
Right. And what needs to happen to understand the pathways to becoming a midwife in the Congo? Is that something that is well understood now?
I think it's the study I did, because I went through the literature. It's a kind of the rare methodology I use, because I use life history and talking with midwives, understanding their pathways. I think from this study, it has brought out their pathways and identify where they face some challenges, and how can we better support them, having known the challenges and having known the coping strategies they develop. So I think from this study now, it's a bit open to understand the pathways of midwives, especially those working in a very difficult, under-resourced environment. So I think from this study, it has brought it up. So I went through the literature. I didn't find any study where they focused specifically on midwives, and where they focused on rural and fragile settings. So it's sometimes very important to understand from their point of view, and having explored, as I said, their pathways.
Your research sounds really fascinating, and I'm really interested to know what will come next for you for this research.
Yeah, thank you very much. So having done this research on being a midwife, I think because the study just focused on midwives. So I wanted to do another research. This is what I'm working on, is on characteristics of different skilled birth attendants in rural Ituri and their distribution. So what are the characteristics of different skilled birth attendants in rural Ituri, and how are they distributed within the Ituri province? So this is the next focus. But another one will be on strategies. Which strategies can be used to improve attraction and retention of midwives in rural and fragile Ituri settings? Because we've got different strategies which are proposed in the literature in terms of attraction and retention of health workers. But I would like to focus on strategies that can be used to improve attraction and retention of midwives, but using a kind of participatory action research, just having it from the midwives' point of view, but also from some health managers' point of view. So those are the two researches I'm working on, and that might come out very soon, I think.
Fantastic. It's a really fascinating study, and I'm really looking forward to the research you do next. Thank you very much for speaking with us on the World Health Organization Year of the Midwife. Thank you.
Thank you.